Struggling with poor circulation in your legs after 75? Swelling, numbness, or cold feet? Today, a top surgeon shares one simple exercise that can dramatically improve your leg circulation safely at home. As we age, one of the most common problems many seniors face is poor circulation in the legs, especially after the age of 75. You may notice your feet feel cold, your ankles swell, or your legs get tired and heavy even after a short walk. Normally, blood flows from the heart through arteries to the legs, then returns through veins with the help of tiny one-way valves that push it back up. However, as we get older, these valves can weaken, and the veins lose their elasticity, making it harder for blood to move efficiently. At the same time, muscles that naturally help pump blood through the legs may become weaker due to less activity or age-related changes. Sitting or standing for long periods can further slow blood flow, causing blood to pool in the lower legs. This can lead not only to swelling and fatigue, but also to more serious issues like varicose veins or discomfort when walking. Common signs to watch for include persistent swelling around the ankles, cold or numb feet, heavy or aching legs, or a tingling sensation. The good news is that improving circulation doesn't require complex exercises or machines. With a simple, gentle routine done regularly, seniors can help strengthen their veins, boost blood flow, and reduce these uncomfortable symptoms. And that's exactly what we're going to show you next, a safe, easy exercise that anyone over 75 can do at home to get their legs moving and feeling healthier. Hi, I'm Dr. Name, and I specialize in senior health and circulatory care. Over the years, I've treated hundreds of patients who struggle with poor leg circulation, swelling, fatigue, and discomfort while walking. Many seniors assume that these issues are just a normal part of aging, but the truth is, while circulation naturally slows down over time, there are simple and safe ways to improve blood flow right at home. Poor leg circulation happens because the veins, which carry blood back to the heart, have tiny one-way valves that can weaken with age, and the muscles that help push blood upward may lose strength. This combination can cause blood to pool in the lower legs, leading to swelling, cold or numb feet, and that heavy, tired feeling many seniors experience. The good news is, you don't need expensive machines or complicated routines to help your legs. There's a single, gentle exercise that can strengthen your veins, improve circulation, reduce swelling, and make walking and standing easier. It's safe, effective, and suitable for anyone over 75, even if you have limited mobility. In the next part of this video, I'm going to show you exactly how to do this exercise step by step, so you can start improving your leg health today and feel more energetic and comfortable every day. Now that we understand why leg circulation declines after 75, it's time to introduce the exercise that can make a real difference. This simple movement is called the seated leg pump, and it's designed specifically for seniors to improve blood flow, reduce swelling, and strengthen the veins in your legs, all while sitting safely in a chair. You don't need any equipment or gym machines, just a sturdy chair and a little bit of space. The exercise is gentle, so even if you have limited mobility, arthritis, or balance concerns, you can still do it comfortably. The concept is simple. By extending your leg and slowly flexing your foot up and down, you mimic the natural pumping action of your muscles, helping blood return from your lower legs back up to your heart. This action stimulates circulation, reduces the heaviness and fatigue that often comes with poor blood flow, and can even help prevent swelling or varicose veins over time. Before you begin, make sure you are sitting upright with your back supported, feet flat on the floor, and your movements slow and controlled. In the next section, we'll go step by step through how to perform the seated leg pump properly, so you can start feeling the benefits in just a few minutes a day. Let's go step by step through the seated leg pump, the exercise that can help improve circulation in your legs after 75. First, sit comfortably on a sturdy chair with your back straight and both feet flat on the floor. Make sure your weight is evenly distributed and your posture is upright, not slouched. Next, lift one leg slightly off the ground, keeping the knee gently bent, and slowly point your toes away from you, then flex them back toward your body, just like pressing and releasing a gas pedal. Move deliberately and focus on feeling the blood flow from your lower leg toward your thigh. Repeat this motion 10 to 15 times for that leg, then switch to the other leg. Make sure to keep your movements slow and controlled. Avoid bouncing or jerking your foot, which can reduce the exercise's effectiveness. You can do 2 sets per leg, resting for a few seconds in between, and it's safe to do this once or twice daily. As you perform these pumps, you may notice your legs warming up, which is a sign that circulation is improving. Remember, consistency is key. Doing this exercise every day will gradually reduce swelling, heaviness, and fatigue in your legs. Even if you have limited mobility, this seated routine is safe, gentle, and effective, making it perfect for seniors who want to maintain healthier, more comfortable legs without leaving their chair. After performing the seated leg pump regularly, seniors can notice a range of benefits that make everyday life easier and more comfortable. First, it helps boost blood flow, ensuring that oxygen and nutrients reach the muscles and tissues in the legs more efficiently. This can reduce feelings of heaviness, fatigue, or itchiness in the lower legs, especially after standing or walking for a short time. Second, the exercise can help reduce swelling and fluid retention around the ankles and feet, a common problem in older adults with poor circulation. Over time, it may also strengthen the small muscles in the calves and thighs, which act as natural pumps to push blood back to the heart. Stronger muscles mean improved support for your veins, helping prevent pooling of blood and lowering the risk of varicose veins. Additionally, seniors often report warmer feet and legs, improved mobility, and a greater sense of comfort during daily activities. The best part is that all of this can be achieved with just a simple, safe exercise performed while sitting in a chair, no equipment, no gym, and no risk of overexertion. By making the seated leg pump part of your daily routine, you can enjoy healthier legs, reduce discomfort, and more energy to stay active and independent, even after the age of 75. While the seated leg pump is simple and safe, it's important to avoid common mistakes that can reduce its effectiveness or cause discomfort. First, don't slouch or lean back in your chair. Keeping your back straight ensures that your muscles and veins are aligned properly, allowing blood to flow efficiently. Second, avoid moving your foot too quickly or bouncing. Rapid movements prevent the veins from fully engaging and reduce the benefits of the exercise. Focus on slow, deliberate flexing and pointing of the toes. Third, make sure your knee stays slightly bent and doesn't lock. Locking the knee can strain your joints and reduce circulation. Another common mistake is neglecting the other leg. Always perform the exercise on both legs evenly to maintain balance and prevent one side from lagging behind. Finally, don't overdo it. Start with 10 to 15 pumps per leg, and gradually increase only if comfortable. Paying attention to these details ensures that each repetition actually improves blood flow, strengthens your leg muscles, and reduces swelling safely. By practicing the seated leg pump with proper form and awareness, seniors can maximize the benefits, avoid strain, and feel more comfortable, energized, and confident in their daily activities. To get the best results from the seated leg pump, consistency is key. Seniors should aim to perform this exercise once or twice a day, ideally at a time that fits easily into their daily routine, whether in the morning after waking up or in the evening while relaxing. Each session should include 2 sets of 10 to 15 pumps per leg, with a short rest between sets if needed. It's better to do the exercise consistently every day than to do long sessions occasionally, because daily repetition helps strengthen the veins, improves blood flow, and gradually reduces swelling and heaviness in the legs. Even on days when you feel tired, a few minutes of this gentle movement can make a noticeable difference over time. Seniors who stick with it often notice that their legs feel lighter, their feet warmer, and walking becomes easier within just a few weeks. To make it even more effective, pair the exercise with small lifestyle habits such as standing up and stretching every hour, keeping the legs elevated when resting, and staying hydrated, all of which support healthy circulation. By committing to a simple routine like this, seniors can take control of their leg health, prevent discomfort, and enjoy greater mobility and comfort in daily life. Many seniors who have incorporated the seated leg pump into their daily routine notice real improvements in just a few weeks. Some report that their ankles and feet are no longer swollen at the end of the day, and that their legs feel lighter and less fatigued when walking or standing. Others say that their feet feel warmer, circulation feels stronger, and even short walks or household activities have become easier and more comfortable. These changes aren't just physical. They also boost confidence and independence, allowing seniors to move around their homes, gardens, or neighborhoods with less discomfort. For example, Mrs. Khan, age 78, shared that after 2 weeks of daily leg pumps, she could walk to the market without needing to rest halfway. Mr. Ahmed, 81, noticed that sitting for long periods no longer left his legs heavy and achy. Stories like these show that even a simple, gentle exercise done consistently can have a meaningful impact on quality of life. By sharing these results, we hope to inspire you to try the seated leg pump for yourself, stick with it, and enjoy healthier, more comfortable legs at any age. Now that you've seen how simple and effective the seated leg pump can be, it's time to take action and start improving your leg circulation today. Remember, the key is consistency and proper form. Even a few minutes a day can make a noticeable difference over time. Start slowly, focus on controlled movements, and gradually build up to 2 sets of 10 to 15 pumps per leg, once or twice daily. Alongside this exercise, try to stay gently active throughout the day. Stand up and stretch every hour, keep your legs elevated when resting, and stay well hydrated, as these small habits work together to support healthy circulation. Many seniors find it helpful to set a daily reminder or pair the exercise with another routine, like morning coffee or evening relaxation, to make it easy to stick with. The benefits go beyond just leg comfort. Improved circulation can lead to less swelling, reduced fatigue, warmer feet, better mobility, and more energy to enjoy daily activities. And the best part is that it's safe, requires no special equipment, and can be done right from a chair in the comfort of your home. If you found this video helpful, don't forget to hit the like button, leave a comment below sharing your experience or any questions you have, and subscribe to our channel for more senior health tips that make daily life easier and more comfortable. Share this video with friends or family members who may also benefit, because everyone deserves healthier, more comfortable legs as they age. Over time, as you make the seated leg pump part of your routine, you'll notice not just physical improvements, but a boost in confidence and independence, knowing that your legs can carry you comfortably through your day. So take the first step today, commit to your leg health, and enjoy the simple power of a daily exercise that really works. Stay active, stay healthy, and remember, you're never too old to improve circulation, mobility, and overall leg comfort. Your legs will thank you.